Good morning. I'm Dr. Darlene Gabeau, a radiation oncologist. I bring you greetings from 21st Century Oncology. And today, I'm going to be working with my surgical colleague, Dr. David Edmondson, to give you a general flavor from the menu of treatment options available for cancer patients. So, when a woman is given a diagnosis of cancer, there are dozens of decision points presented to her. Imagine being famished, entering a restaurant that you're not familiar with, and looking at a menu with lists of items and their descriptions, none of which you've ever tried. If you're overwhelmed with hunger, that process of choosing can be daunting. When I find myself in that position, my default response is to ask what the chef recommends. And so it is in medicine. A woman diagnosed with cancer should never have to make her choices in isolation. Her doctors are there to help her with that. And as with any good chef, the recommendations tend to be multiple courses and involve multiple specialties, all revolving around the main course. In cancer treatment, the main course is that which eradicates the bulk of disease. Let's say the way a beef bourguignon and a pinot noir might eradicate the bulk of your hunger. Often you don't just jump into the main course. There may be preparation necessary to decrease the burden of the cancer before you get to that major treatment. That is the neoadjuvant course, and its goal is to lighten the load for the main course. The way maybe a succulent goose liver with champagne might take the edge off as your beef burgundy is being prepared. And once you go through your main course, you're often not done yet, because there may be concerns that there's subclinical disease that, if left unaddressed, might shorten or decrease the effectiveness of that major treatment you've just had. And in that situation, there may be a recommendation for an adjuvant course. That is, another course of therapy that eradicates subclinical disease and consolidates all that hard work that the main course did. And similarly, maybe a creme brulee with some espresso might really help to solidify that satisfaction you've gotten from that main meal. So I wish that our specialties in cancer care were as delicious as French delicacies, but they're altogether different. And they include surgery, radiation, and systemic therapy. And today, Dr. Edmondson and I, in our remaining time, will cover some of these specialties with you. But first, I want to emphasize for you that as our goals in cancer care evolve, so do our approaches. Classically, our goals have been to eradicate disease, often using very aggressive approaches by any means necessary, with the overall aim of prolonging remission and prolonging survival. But thankfully, as our knowledge and our technical capabilities have advanced, so have our ability to become more sophisticated in our approaches, so that not only are we trying to eradicate disease by any means necessary, we're also considering other important endpoints, such as the preservation of a patient's function, such as maintaining a wholeness of a person and preserving cosmetic outcome, and also respecting quality of life and considering that in presenting choices to patients. And our ability to be more sophisticated in the approaches that we recommend is powered by advances in clinical science, in technology, and in our basic understanding of molecular and genetic mechanisms. And clearly, clinical trials are essential for this progress. And Dr. Di Silvestro and Dr. Moore are going to be talking to us a little bit about the role of clinical trials in cancer later this morning. And so we are evolving in our approaches toward maximally treating cancer, and that evolution is true for really all of the specialties: surgical, radiation, chemotherapy, going from a big hammer approach to a more refined, more tailored approach for patients. And so we'd like to discuss with you, Dr. Edmondson will present surgery, the classical main course.